Good afternoon and welcome. Thank you for joining us today for our training, Tools for Creating Calm in Times of Distress, Part 3, hosted by the Center of Excellence for Behavioral Health in Nursing Facilities. I am Nikki Harris, Training and Education Lead for the Center of Excellence, and it is my pleasure to oversee the delivery of mental health and substance use disorder training to nursing facilities nationally at no cost to the nursing facility. And now, I am happy to introduce our presenter for today, Mr. Matthew Rosa. Matthew is a licensed clinical social worker, consultant, and founding member of NIATEX. Matthew provides training, coaching, technical assistance, and planning support to universities, research studies, governments, and health and human service provider organizations. Matthew's current area of focus include evidence-based practice implementation, process and quality improvement, staff and team development, and a wide array of training topics. I'll now turn it over to Matt to begin the presentation. Thank you.
Thank you, Nikki. I appreciate that. And it's great to be with all of you today. I think we have a nice opportunity because we're going to spend an hour together to explore these issues with a little more depth. And that's the intention of this session and our subsequent sessions. So we'll have some more space to get some feedback and interactivity with you. That's our intention, to have you use the chat. And we have a few polls lined up as well. So we have three objectives that we want to explore with you today. Number one, identify common projection scenarios. We introduced the idea of projection when we spoke previously, the idea of transference and countertransference. So these projections that result in this transference and countertransference, we'll talk a little bit further about that. We want to talk about an empathy map, which is a nice tool to try to understand better how to address and respond to situations where someone pushes your buttons, where you might have some reactivity to a certain resident. Also, in relation to colleagues and other folks on your team, you can apply this tool in a lot of different ways. And number three, to plan some strategies for avoiding unproductive reactions to strong emotions. When folks with whom you're working, residents or other folks, are eliciting strong emotions, how do you manage so that you don't have unproductive, strong reactions to those expressions? So those are our three areas of focus for today. So I think we'll be able to dig in and explore them, as I said, for the hour. It's helpful to kind of reset ourselves to our primary broad agenda here, to think about this pivot that we've been talking about. You engage with individuals, there's a mental health need, there might be some distress that is shared, and this pivot, which takes us to some space where we can use some tools in an efficient way so that you can save time and become more effective and efficient so that you can continue to do all the tasks that you need to do as part of your work with people. So that's really what we're about, is trying to find efficient, effective ways to manage those moments of distress effectively. Rather than just kind of trying to power through them, let's use some effective tools and strategies that can ensure that everyone has a positive and healthy relationship dynamic, and that the results are where we want them to be in terms of the ongoing connection to people and the ability to continue to provide quality care and supports. We introduced this idea a little bit previously, this notion of transference and countertransference. So you have folks who might sort of project things onto you, for example, residents in a facility, and you may have reactions to them as a result of that. So the idea of pushing your buttons, you have certain folks with whom you find yourself feeling some reactions, some distress because of maybe their affect and how they express themselves. Perhaps it's some of the things that they might say. So we want to think about those together today. And we're going to use some tools that will help you to really be more focused and understanding, because this insight is going to be really helpful to you in the bigger term, longer term picture, so that you can avoid any patterns or stressors for yourself. So think about this as a self-reflection. We want you to think about your own experiences and how they impact how you see yourself, how you see the people you're working with, how you see residents in your facilities. So listen to this simple equation here. Because the environment I grew up in included X, I tend to react strongly. And by strongly, we don't mean that in a judgmental way, but I tend to react more than other people do to why, to certain things. Everyone can kind of consider your own experiences. Um, for example, I grew up in an environment where there was some depression, and I grew up in an environment that had a lot of raging, kind of hostile responses. I react very strongly to those expressions, and I've noticed throughout my career when, say, someone is the boss and they sort of get angry and pound the table in the conference room, which I've experienced on a number of occasions in the past. Other people seem to just respond and say, no big deal. I don't, whatever. They were frustrated about something. Well, that's not how my nervous system responds. I respond with a lot of intensity to that, and I have a lot of reactions that I have to manage. Each of you has different experiences, which result in you being more sensitive and responsive and reactive to certain kinds of environments. And so it's really helpful if we're aware of that so that we can be mindful and manage those situations more effectively. For example, in my case scenario, if someone gets frustrated like that in a meeting, I need to remind myself that everybody's okay. I'm okay. I don't need to protect anybody. I don't need to hit the road and get out of this meeting. I can just kind of try to calm myself down and feel okay with that. I don't have that issue now because this was something that I addressed and was focused on and became aware of at an early point in my career. So we all have those, right? Everybody has those. One of the ways to think about those, ask yourself, what is your X? What is your Y? Right? What are the things that make you who you are in terms of the environments that you have experienced? And where do you then tend to have strong reactions? One of the best ways to do this is to look at ACEs. Some of you are probably familiar with ACEs, adverse childhood experiences. This has become a really a powerful and widely used tool for trying to understand the kinds of environments that we have lived in and how those early environments impact the way we experience our current environment and the people and the encounters that we have. So I'm going to go through these questions and have you just on your own sheet of paper. This is not for sharing, but just take a little sheet of paper and I want you to make a little check mark every time you answer in the affirmative or to the positive with any of these items, okay? Number one, did you feel you didn't have enough to eat, had to wear dirty clothes, or had no one to protect or take care of you? So if that's a yes at any point in your early experience, then just make a check mark, okay? So we're going to go through 10 items and you can just kind of create a list for yourselves. Number two, did you lose a parent through divorce, abandonment, death, or other reasons? Okay, so note that we're talking about these sort of difficult adverse experiences. So I just want to be mindful of that. And some of these ideas might create a little bit of a trigger or response for you. So I just want to be aware of that with you as we look through these. Again, we're not sharing this information. I'm just having you make your own list. Okay. So number three, did you live with anyone who was depressed, mentally ill, or attempted suicide? Did you have that experience as a child or young person? Number four, did you live with anyone who had a problem with drinking or using drugs, including prescription drugs? So again, with each one of these for which you have an affirmative, a yes response, just make a little check mark on your sheet. Number five, did your parents or adults in your home ever hit, punch, beat, or threaten to harm each other? And that's the first half. So now we'll look at the 6 through 10 items. Number six, did you live with anyone who went to jail or prison? Again, making a check if any of these are in the affirmative. Did a parent or adult in your home ever swear at you, insult you, or put you down? Number eight, did a parent or adult in your home ever hit, beat, kick, or physically hurt you in any way? Number nine, did you feel that no one in your family loved you or thought you were special? Number 10, did you experience unwanted sexual contact, such as fondling or oral, vaginal intercourse, penetration, so sexual abuse or violence, number 10. So again, private information, we're not sharing this. I'm just asking you to make a check mark for yourselves on these 10 items. So if you take a look at that list that you've created of these 10 items and thinking about which of them, first five and then the second five, which of them apply to you in your own experience. The more of these you have, the more likely you are to have a need to address some strong reactions to distressing circumstances. because you have had significant adverse childhood experiences, some of which on this list, all of which can create some degree of trauma, some of which are obviously extremely high level traumas. Some of them are lesser, but still significant areas of trauma, which then can create a lot of reactivity in future experiences. So to the degree that you have items from this list in your past, that will push you to be mindful and to be considering how it is that you can manage any reactions you have to situations that might trigger some of the emotionality that's the result of those more painful traumatic experiences from the past. So the idea here is to have this self-awareness. I know, again, what pushes my buttons. Certain things push my buttons. If you have some of these things in your past experience, then certain things will push your buttons. And if you have a resident who acts in a certain way, speaks in a certain way, is expressive of a certain kind of emotionality, which relates to any of these adverse experiences that you had as a child, your vulnerability to reactivity is high. Right. And there are things that we can do to manage that. Self-awareness is the first thing and the most important thing. There are plenty of ways that you can get support. I always encourage people in terms of counseling or therapy for themselves, working with your supervisor, getting support from your peers, from friends, from other parties who know you well, to be able to process and manage any reactions that you have. But again, the first and most important element is to have that self-awareness. We all have reactivity. We all have things that trigger responses based upon the experiences that we've had in the past. So, let's talk a little bit about this idea of projection. We mentioned this in an earlier session. The one way to think about projections that people might have on you, people who are residents, for example, are to fill in the blank of the sentence. I can tell that. So if the person might be seeming frustrated or a little upset with you and they say, I can tell that, and then take a look at this list. Here are some things that people might say. You don't respect me, you don't like me, you think you're better than me, you don't understand what I'm going through because you've never suffered like this. I think you're just here for a paycheck, you don't care what happens to me, you're just like my family, you don't want to help me. And maybe there's some other ones, and feel free to put them in the chat right now. These are some phrases that you might have heard. Is there another variant or version or another one of these? Feel free to put it in the chat. Something that someone maybe in your work has projected onto you, has said, I can tell that, or some version of that. Does anyone have anything else other than these items that you can share that people have said or expressed to you as you've been doing your work? And sometimes they're kind of painful ideas. Does anybody have one that they'd like to share? You get to go home. Yeah, thank you, Susan. Yeah. So, you don't understand. It's a way of saying you can't understand me. I can tell that you can't understand me because you don't have to stay here. You get to go home. So that's a pretty strong kind of a judgment of their sense of your ability to have empathy or understand them. At least that's how I interpret that one. Maybe Susan, your others might interpret it differently depending on the circumstances, but generally that's how I would see it. Who else has one? Anybody else have one that you've encountered where folks have said, "Oh, I can tell you don't," or "I think you," or anything like that? Other than the things that we have on the list that you've heard from folks, maybe from residents who are upset or distressed about something. Feel free to put it in our chat if you're thinking of one. And sometimes they're tough, right? They can be very painful projections. They can wound. It's important to remember that as well, because some of these messages can be very hurtful, and we need to acknowledge that we're human and we have a human response to some of these items or expressions, and then they can wound us, and we need to be aware of that reality, because that will help us to avoid the reactivity that can cause a progression of the conflict or of the distress that's being experienced. So here's what I'd like to do. I want to have a dialogue with you in the chat. So here's what I'm thinking. I want to have you extend this little conversation we've been having here as we got started. I want you to think about one negative thing that people have projected onto you. Maybe it's something from the list that I just shared. I think some of the items I shared are pretty common, so probably a lot of you have had a resident express one of those, at least one of those to you. They're pretty common ideas. The one that Susan shared as well, I think that one's relatively common too. So think of one of those. I can tell that you or you don't understand because, or uh, those kinds of ideas. And I want you to give me 3 bits of information. One, what's the negative projection, the thing that they're stating as a judgment of you or an assumption about you? Um, what's the emotion that you see in the person? And here's a list of emotions at the bottom, simple list. You can use other words if you want to, but I just use that as a sort of a simple list to pick from if you're wanting to use it. So what are they projecting onto you? What's the emotion that you think you're experiencing from them? And how do you feel in response? What's your emotional reaction? And you can again use the list. As we do this, I want to encourage some candor and dialogue because there's absolutely no harm in acknowledging that you got angry or that you were feeling sad or disgusted by someone who said something mean to you. There's no harm in that, and it's not a compromise in the quality of care because acknowledging an emotion is what we do to ensure that we maintain a high quality of care, right? So I say that because some of you might be a little self-conscious and say, well, someone said this kind of harsh thing to me. I could tell that they were angry and I got angry in response. Getting angry is an emotional state. It's not an action. Okay, so it's perfectly fine to acknowledge anger in response. When I was talking about, my boss pounding his fist on the table, I got anxious and I got angry, quite angry at the time. Now, there's a million things I can do with that are constructive, and a million things I can do with that are not constructive, that are destructive to a relationship or to the environment. So I'd like you to take a minute, think of these 3 things, and to have some of you share in the chat. So this is where you get a chance to, I think, really help your peers, help our community out by saying what you've encountered. Negative thing that people have projected onto me. What's the emotion that I think is they're expressing, and how did I feel in response? So that's the 1, 2, 3. So take a couple minutes and try to give some of those. So I see we're starting to get a little activity here. Yeah, so Lee started us off. I can tell you don't care what happens to me. And Lee, if you could then say, what's the emotion that you think that person is expressing? And if any of you want to do these all as one chat, that's fine. 1, what's the thing they're saying? 2, and there's Lee following up. The person is angry. And then how did you feel in response to that? What was your emotional reaction? Defensiveness. Yeah, absolutely. Yeah. That makes perfect sense. And then we have from Barbara, you don't care about me. The person's angry, and then you had some sadness in response to that. So this person's feeling like you don't care and is mad at you, and you have a sadness in response. Again, these things can be wounding even though we don't agree with them or think that they are true. They're still hurtful, right? They're still hurtful. And so we have strong emotional responses to them, and we can get distressed and emotionally dysregulated as a result of these things that are stated. So Rebecca said, you don't understand what it's like. The person seems angry. And then this feeling of defensiveness. Yes, thank you for this. Other people, give us a few more. These are great. I really appreciate the trailblazers here, the first few folks who share some stuff, and this is going to carry over into our future conversations. So I just want to honor those who are the folks who go first to kind of get us rolling. I really appreciate that. Um, I can tell you can't help me, the person says to Casey. They're upset, they're angry, and then you in response have anger. You're trying to do your thing. They're saying, I can tell you can't help me, which is a different variation because that sounds like a judgment of your competency. Like, I don't think that you're capable, maybe, or that you're interested, willing, whatever it might be. I can tell you can't help me. And they seem angry, and I could see absolutely feeling some anger in response because that's a pretty kind of insulting comment to encounter, right? Because you're trying to do your work to the best of your ability. And Marianne says, don't care, then anger and defensiveness. So we have a good number of you having that defensiveness feeling, which I think makes sense. So anyone else, somebody else want to share one, share your experience of this sequence, something that they projected onto you, the emotions that were behind it, and how you felt in response to it. That's the 1, 2, 3. Anyone else have one that you're thinking of that hasn't been shared? Maybe something different, a different kind of experience, or a different kind of a projection. Oh yeah, Haley has one. You need to smile more, condescending, and then your result was to be angry, right? Well, we know that there's often some gender dynamics in a lot of care environments where and women are often told by men to smile because and they almost never, men in the workplace almost never have anyone telling them to smile, me making the assumption with regard to gender and Haley's status. So whether that's accurate or not, I don't know, because I don't know Haley, but I'm just sort of noting that in environments, particularly where there are a lot of women giving care to men, but also that could have come from a woman as well. I don't know who stated that, but it reminds me of how there are some gender dynamics there that can be insulting and hurtful, and as Haley described it, condescending. It's not respectful of Haley in that moment, and the response was anger, which makes perfect sense because it's a kind of a disrespectful approach. I'm guessing that other folks who come through the system, maybe in different roles or with different status or roles, might not have someone saying, you need to smile more, right? Sincerely being happy, you want something. So Mary, I think, is describing that maybe someone misinterpreting the kindness or friendliness of the happy expression being interpreted from a place of distrust, or someone saying, oh, what do you want? Because you're being nice, so you're trying to manipulate me. You're trying to get something from me. I don't trust you. I don't think that you're being genuine with me. So the projection there is you're not trustworthy and you're being nice, but you're trying to get one over on me. So sounds like, Mary, we have that right. That's an accurate interpretation, I think, of what you were saying. And that can be pretty painful too. Here you're doing your best to maintain a level of energy and kindness and friendliness as you're interacting with someone, and they interpret it from a place of distrust. I can't trust you, and so I think that this is a manipulation, that this isn't real. So, so Mary, if you have a final conclusion on that, like how did you feel in response to that when they were saying, I can't trust you, basically, I think you want something, you're trying to manipulate me. How did you feel when that happened? Surprised. Okay, surprised. Yeah. Bernice says, you look like a baby. What can you do? Angry, sad, said Bernice. Yeah, you look like a baby. What can you do? So the person is projecting based upon your age or their assumptions about your appearance. Some people look older than they are. Some people look younger than they are according to other people's perceptions, right? And so people who are on the younger side in a work environment, or who have the appearance of being younger, will sometimes get this projection. How could you be helpful? What could you do? You don't look old enough to know how to do these kinds of things, or you don't look like you maybe have had enough experience or training. So the projection onto you based on youth. And the older people get, the younger people look. Many of us have had that experience in our own lives. I know I have. I'm old enough to sort of see high school students now as my children are now adults, and they seem really, really young. They seem younger than they did when my kids were in high school, because the distance I have from them is farther and farther, right? So there's a projection there based upon those experiences. So here we have that Bernice is describing. And so that created some responses of anger and sadness there, right? So these are all really powerful and thoughtful examples, and I really appreciate everybody sharing. So if we think about this one that we heard, defensiveness, I want to push on that one a little bit. Defensiveness is not really an emotional state. It's kind of a reaction to certain kinds of emotions. So if you started off with describing it as feeling defensive, I would suggest that it started off with an emotion, and it's probably one of the emotions at the bottom of this slide, and that emotion then translated into a defensiveness, where defensiveness is you kind of putting up a wall as a way of distancing and pulling back from that person as a result of that kind of hurtful or as a result of that attack. You're going to kind of protect yourself from that with a defensive posture and response. It started with a feeling. So think for a minute, look at those feelings. You can share it in the chat if you want, or just kind of reflect on it for yourself. If you're feeling defensive, it's because you had an emotional experience, an emotion that was felt that was probably one of those. And so to think about what that might be. Was it sadness? Was it fear? You felt like the person was saying a wounding thing that created an emotional response, and then you got defensive. Again, perfectly natural and normal human response, right? So try to get past that defensive definition and say, okay, what's behind the defensiveness? Because I have to have a feeling first before I pull back and get defensive. So that's really the root of this. And that's what we want to know about for you to be most effective in those moments, to say, okay, when people do this stuff, this is the kind of reactivity that I'm likely to have. Okay, this is the kind of stuff, the emotion that's going to come up for me, and how do I manage that effectively? Okay, so these are all really good. I really appreciate everybody sharing these different experiences, really thoughtful reflections. We're going to bring up some polls here. So I want to start with our first poll. We're going to ask you, what emotions did you experience in response to these projections? This will give a chance for everybody to share. Not everyone, of course, has had a chance in the chat. So we're going to launch a poll where you're going to pick all of the emotions that apply. When people have projected onto you in these various ways, as were described in the chat or as you've experienced in your work, what kinds of emotions have you experienced? So Derek, if we could go ahead and launch this first poll. Here you all see the poll. So pick any and all that apply to you. Which of these emotions have you experienced in response to these projections? So go ahead and give us some feedback. I really encourage everybody to respond. Again, anonymous poll. We like to have a nice volume of participation so we get a sense of the group. So go ahead and pick all that apply to you. And as we get to, as it starts to slow down, or as we get at least past half of our group, Derek will go ahead and share that with us so we can see what kinds of things people have been experiencing. And again, you can choose as many as you like, because you may have experienced more than one of these. It's likely that you have experienced more than one of these. All right, so yeah, so it's interesting. We have a full range here. Sadness and surprise and anger in the top three. Surprise being the biggest, right, and closely followed by anger and sadness, which have the same amounts. I really appreciate everybody sharing. It's very helpful. Fear is the least common. I think that makes sense given the environments and the dynamics of sort of felt risk in the environments in which you're working, that the fear factor, although substantial, is a little lower than the others. It's still pretty significant though, right? There's quite a few folks who have encountered fear in response to what people have said. Disgust, right? We hadn't really talked about that one before, but maybe people saying hurtful things, or expressing beliefs or attitudes that will result in a pretty strong emotional response of disgust. So this is helpful, right? So again, what we're trying to do is remove any shame from these reactions, right? It's perfectly understandable and reasonable for you to have these emotional experiences and as a result of some of these projections. What we then can do if we acknowledge them openly is to sort out how to manage them. How do we manage them effectively? So here's the tool that we can use, which is called an empathy map. So here's what I'm going to try to encourage you to explore with me right now. I want you to think about one of these people who has had one of these projections. Your examples that you used when we've been exploring this so far in this session, use that example. Someone who did something that was a projection onto you, where you had some emotional response to that. So we're going to use this tool called an empathy map to kind of explore that a little bit. So here's how this works. Empathy map has these boxes. If you have a piece of paper in front of you, I would encourage you to just draw this 4 boxes up here. In the center is a picture of the little stick figure. That's kind of where you could put the name or just a way of identifying, or you just remember who the person is. And at the bottom, there's a box, and that's where the goals will go, okay? So draw yourself a little picture like this. What I want you to do is work your way through this with me, and I'll show you how this simple tool works. What we do is we start on the left with what the person says and does. So in relation to that experience you had with them, what did they say? What did they do? Right? So write those in those 2 boxes, right? Write what they say and write what they do in those 2 boxes to the left. So that's the first thing we want to do. So go ahead, you just maybe write down a couple of bullets, just a simple phrase or 2. Some of these encounters were brief, maybe some were longer, just a few bullets about what they said and what they did. That's your first task. So go ahead and write that down in relation to this person who had this projection onto you, where you had some emotional response. So once you had a chance to write down what they said and what they did, then I want you to move. So you've got something that looks like this, right? What did they say? What did they do? Then I want you to move over to the right side of that box. The box is on the right. What were they thinking? What were they feeling? Now, your reaction might be, I don't know what they were thinking or feeling. They didn't explain it to me. So this may be a little bit of conjecture on your part, making some assumptions. Based on what they said and what they did, what's your understanding of what they were thinking, what they were feeling? Kind of relates back to what we were talking about before. You were giving me some feedback in the chat about their expressions and what you thought they might be feeling. So we're doing that. We're asking everybody to kind of frame this up in this tool. So based on what they said and what they did, what did they think? What were they thinking? What were they feeling? So fill in those right-hand boxes of this empathy map. Now, once you've had a chance to write these items in the right-hand box, then we go down to the bottom of this empathy map, and we're talking about goals. Goals might seem like an odd word, right? What do you mean by goals? What am I talking about? So, what were they trying to accomplish? What were they seeking? What were they trying to do? What did they have as a goal as they communicated what they were communicating? It's sort of a different way of thinking about this. What were they trying to get done by saying what they said to you? What was their agenda? Were they trying to protect themselves? Were they trying to be hurtful to you? Were they trying to change what you were doing to have you do something more or less to kind of sort of help kind of elicit a certain response from you? What were they trying to do? And this might be fuzzy, but I want you to sort of take a stab at it. What do you think was going on for them based on what they said and they did, based on what your understanding of their thoughts and feelings is? What were they trying to do? What might their goal have been in that moment when they were engaged in that projection onto you? So then write whatever you might think would have been the goal in the box at the bottom of the empathy map. This is a tool that I like to use a lot because it's simple, it's straightforward, it's relatively easy to use, and has a lot of flexibility. I want to encourage you to just use this simple tool whenever you have one of those uh, distressing moments in order to process it and sort through the experience. You can also do it with a colleague, do it with your supervisor, do it with other folks. So, what did the person say? What did they do? What did they think? What did they feel? What's your understanding of those? And what were they trying to achieve? We call it an empathy map because we're trying to understand the person's experience. As per one of our previous sessions, when we kind of defined empathy, empathy is this understanding of a person's experience, trying to put ourselves in their shoes. What are they experiencing? Why is it that they're responding to this situation the way that they are? What's going on for them? This helps us to get a better sense of that. And if we have more of an empathic understanding, then we're less likely to be highly reactive to that person because we know where it's coming from. As per some of the emotional states that you all described in the chat earlier, right? You kind of have a sense of where it's coming from. So there you have that tool. I want to ask you another poll question. After I describe this, then Derek's going to go ahead and pull this one up. What are they trying to do or what do they want? So this is the goals question, right? So we're going to pull up a poll and the poll is going to have 6 options. So I'm going to ask you, and Derek's going to pull that poll up for us, to 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 check all of the items or any items that apply to the situation that you were considering when you were doing this empathy map. You had a certain person in mind, a certain situation in mind. What did you come up with for goals? What were they trying to do? Were they trying to hurt you, harm your career, get you to help them, try to help you to understand them, to get some relief from some pain, either physical or emotional? Was it something else? So if it's something else that I didn't have on this brief list, then check that 6th box. So go ahead and give us your feedback on what this particular scenario that you described with your empathy map, what's your understanding of what the goal was for that person in that moment when they were projecting. So go ahead and give us your feedback. And when we get to a pretty high percentage, Derek can go ahead and publish it for us so we can get a sense of where people are at with this. And again, you can select more than one. Sometimes these things are complicated and people may have multiple motivations. Try to think of this specific situation that we described that you were considering with the map that you created. And again, this is a map that you can create for any different situation. So let's see what we have for results. A small number of folks talking about the individual seemingly trying to be hurtful or to harm your career. Those are pretty dramatic situations, and I absolutely want to honor that a couple of people did have experiences in those categories, and so those are very, very concerning and probably very stressful for those of you who encountered those. Higher numbers in the to get you to help them. They seem to be trying to get you to help them, to feel understood or to feel relief from pain. Those are items that would probably, if you focus on them as the goal, provide you with an opportunity for more of an empathic response. All right, the person is projecting onto me. They're saying something that might be kind of hurtful or stressful for me. Um, I have an emotional reaction. If I understand their goal, which is they're trying to get my attention or get me to offer them certain supports, I may be reacting to how they did that, and I can have some empathy for what it is that they're trying to achieve because I understand that they're struggling in some way. Um, a number of you described as something else. If you said something else and you're comfortable doing so, I would like to see you put that in the chat for us. If you said something else, what was the something else that was the goal that you put on your empathy map? What did you see them trying to achieve? If anyone's comfortable in doing that, I would love to see those. Protect themselves from being taken advantage of, right? Feeling insecure, right? Okay, thank you both for those. Now, see if we look at those are very empathic comments, very empathic statements. Those can be a strong root for an empathic understanding of someone who maybe said something kind of harsh or cruel or nasty or mean, um, and they're trying to protect themselves or they're feeling insecure. And if I can stay in touch with that, I can maintain my empathy and my reactivity will drop, right? I will still feel a reactive emotion, but it won't translate into influencing my behavior or influencing my care in any way, because I'll know where it's coming from. That's powerful. So thank you, Mary and Cindy, for sharing those. Anybody else have one that was different? Feel free to share it with us so that we can keep an eye on that. And again, I do want to come back to the folks who did say something about how thinking that the person was seeking to be hurtful or to try to harm your career or harm you in some way. I mean, those are very painful situations. I would also offer that these things may be complex. And sometimes people may be seemingly doing something that is seeking to hurt you. It could also be inclusive of one of these other items. They may be trying to get help. And the way that they try to get help is to be hurtful toward you, as to get attention related to whatever their issue or concern is. Please understand, this is not in any way me dismissing the pain of someone seemingly trying to be hurtful to you. It is, and I'm not excusing something that might have been a very difficult situation for you. It is, however, helpful for us to think that maybe there's something else going on here too, so that we can understand the situation, particularly if we have an ongoing care relationship with that person. Is it also because they wanted to get me to do something or to get some help from somebody, or feeling like no one was helping them, so they started kind of acting out in a hurtful way toward me? And was it really about me, or was it about kind of their broader frustration with some perception that they have, accurate or not, based on our perspectives, but it's based on the resident's perspective? They're feeling like they're not getting the care that they deserve or that they want. Again, everyone's perceptions are different in these situations. And so if there's a mix of things there, that can help us too. So if it's exclusively the sense that they're trying to hurt me versus they were seemingly trying to be hurtful to me, and again, asking why. Well, why would they do that? Is it personal, or is it something else? And if we can pull it away from the personal toward the broader idea of trying to get something else to happen, a different goal, again, that will help us in terms of our own reactivity to that situation. So hopefully that's a helpful way to think about it. So then again, these unproductive reactions, we've talked about a lot of your emotional states, emotional experiences, and then thinking about what are productive reactions based on those emotions and what are unproductive in terms of your reactions and how you respond to your own anger, sadness, fear, disgust, surprise related to whatever has transpired with that person. How do you manage that effectively? I want to ask you this question. When you have these encounters that we've been talking about, who supports you when you have those encounters? Who can you share these with? You've been sharing them here. Some of you have been sharing them through the chat with your names attached. Some of you have been sharing them more anonymously through our questions. How do you share your reactions or your counter transference? Who can listen to those? I'd like you to make a list of at least 3 people at work who you trust. You can share your reactions, your countertransference. When a particular resident says something that's kind of directed towards you with some sort of a projection and you have an emotional response, who can you share that with? Make a list of 3 people who you can trust to share that with. That's 3 people at work. And then make another list, 3 people outside of work. If you have a hard day and you had a particular resident who you were trying to care for, and they said or did something that was quite a strong projection that was directed towards you or kind of harsh towards you, who can you trust outside of work to share that with, to try to resolve, to try to explore that? And again, using the empathy map tool, you might use that tool if you filled it out and it looks like this because you got stuff in all 5 quadrants. Maybe that's what you bring to that relationship, particularly in the workplace, to say, here's what I experienced. Here's what the person said. Here's what they did. Here's what I think they were thinking and feeling. Here's what I think they were trying to do in their goals. Here's how I felt in response to that. And let's kind of figure out how we manage the care dynamics, the care situation as a result of that. So we have another poll that we want to ask you. If I tell my supervisor about my emotional reactions toward a particular resident, again, those emotional responses to that projection, what's the response that I'm going to get? Are you going to get high level support, moderate level support, low level support? If you say, this person did this stuff and I'm having a reaction to it, and here's what my reaction is. So pick one of the three. This is a single answer response. Will you get high support, moderate support, or low support if you talk about those emotional reactions? What's your current perception? So go ahead, and I'd like to have everybody respond to this. So please, again, these are anonymous polls. So we would like to get a nice high level response here. And as soon as we get to a good high level, Derek will go ahead and share it with us, share our results. So let's see. So high level support was the largest response, moderate level, and then low level support. Okay. So I want to just note this. Good news, high level support is the most popular answer. And I want to note that there were a good number of you who reported moderate and lower levels of support. And so that's important for us to think about this. If you reported moderate or low level, what is it that can be done? Is there anything that you can do to cultivate the kinds of support that are available to you? Is there anything that you can do? And this was specifically in relation to your supervisor. Some of you may have other supports, but of course the supervisory support is particularly important in these situations. It's not exclusively the only way you can get support for this, right? There are peers in the workplace, other folks with whom you work who can be supportive of you. And the supervisory support has a particularly important element, given that they're the person who to whom you report in your work role. So if it's moderate or low, I want you to think about that a little bit. Is there anything that you can do to cultivate this? Is there any way that you can talk with your supervisor to discuss what you might need or a concern you might have if there's some supports? Is there a way that you can activate higher levels of support? Some of you may respond to that by saying no, because they're not supportive around this. And I always encourage people, that may be the case, but I also encourage people to ask the question, is there a way that I can be assertive with my need? Many of us will be assertive with a need for a day off for something, even though it might not be convenient or aligned with the calendar or in alignment with certain requirements. It's harder to ask for some support for a stressful situation. But is there a way I can be assertive to try to elicit some higher levels of support? Have I really expressed how hurtful these things are? Many of us are quiet about this. We experience these projections and they're painful, but we don't tend to let people know that they are painful, and we don't tend to let people know that they wounded us and we had some strong emotional reactions to them, because we're fearful that that will make us look less capable, less competent, less professional. From where I sit, the opposite is true. If you have self-awareness in order to understand your own emotional reactions to a circumstance and are able to thoughtfully communicate that, those are the people, from my perspective, who have the strongest capacities to be professional in their care delivery. Those are the people who are least likely to have reactive behaviors that will be problematic or that will be inhibit or reduce the quality of the care that they can deliver. Because if you know yourself and you know your reactions, that's the most protective situation in terms of maintaining a strong, healthy relationship with the residents and people in your workplace. So do your best, if you can, to try to support your supervisor in understanding what your needs are. I will acknowledge, of course, that not all supervisors are created equal, right? Some are more attuned to this particular issue than others. And so if you have a supervisor who's highly attuned to this kind of emotional support, then you have that environment that is more supportive. If you have a supervisor who is less attuned to this, are there things you can do to draw their attention to kind of create a little bit more of a supporting environment? And are there other people in your work environment to whom you can share, with whom you can share, and who you can trust as a support for these kinds of situations? So Thinking about mentors, who is your role model for effective professional response in the face of this high distress, these strongly negative projections? Are there people you see in your workplace who manage these things really effectively, who seem to deal with some of those projections and challenges? And have you asked them how they manage it? Have you asked them what they do? And can they help you? Can you have some sort of a mentoring relationship with them? Mentoring doesn't have to be a long-standing, career-long mentoring. Mentoring can be little bits and pieces here and there. Like there's someone who knows something that I don't know, or can do something that I might struggle with. How do I manage that? We're going to wrap up with one final poll. I'd like you to rate the level of burnout that you're experiencing or empathy fatigue related to managing these kinds of distress. How are you feeling right now related to this stuff that we've been talking about? Your rate of risk for burnout, empathy fatigue, give us a quick feedback as we wind down for today. What's your level of risk? How do you see yourself? Low, no risk, low risk, significant risk, high risk, very high risk. So give us a quick response so that we can just be mindful. I want you all to be mindful of your felt sense of risk, how these situations create reactivity for you and might put you at risk as you deal with some of those projections and distressing situations. So as soon as we get to a decent number, Derek will go ahead and publish that to get a sense of where people are at. All right, so significant risk, low and very high. All of you are experiencing some risk, which is what we know about your workplace environments, and that's why we're talking about this stuff, okay? So note those of you who said very high risk and significant risk, I think it's an imperative that you work to address these things so that you can keep yourself healthy and safe. Thank you for sharing that, Derek. And so this last slide is, again, a reminder to get help, to make sure that you are reaching out to folks who can assist you and provide you with the support that you need. So we're going to wind up there. I'm going to appreciate and thank you all for your sharing, and I'm going to hand things back to Derek.